Hello, welcome to Global Development Issues with Arrey Ivo. The issue of environmental degradation is very rife across the world, and the degradation of our environment has led to a lot of other issues, especially the emergence of diseases. And these diseases are causing concern among scientists as well as local people who find it difficult to moderate their excesses or to control them or manage them with very scarce resources that are an incidence of other issues or greater issues like climate change. Remember the SARS outbreak a while back, and this caused a lot of disturbances in our economic reviews, in our economic activities, as well as other issues. In Asia, at least, travel was very difficult and it came to a standstill. There was also the H1N1 that also affected tourism, and it also affected the capacity of governments to make revenue out of tourism and other touristic related activities and professions. In recent years, we've seen other outbreaks. We've seen the bird flu, the swine flu, the Nipah virus, dengue, and even malaria that is known to be around the corner for a long while seems to be increasing in some areas because of the degradation of our environment. Sometimes the degradation is caused exclusively by man, but sometimes it's also fallouts from changing environmental conditions. There is substantial evidence to show how better regional planning and development, however, including urbanization, agricultural expansion, and conservation of forests and ecosystems can help to minimize and even reduce such outbreaks. There is no fixed solution to these outbreaks, but there is the inclination to believe that if things are done in an integrated manner to include various stakeholders affected by these issues like a degrading environment and also the rise of diseases, which play a very serious role on the number of people who are working, on the GDP, on access to incomes, access to education, and so on, it will help to reduce the situation or to manage it in a way that it will not affect the majority of people, or it will not be increasing in the 21st century. Now, let's concentrate on dengue fever to get analysis on how it is getting more rife with changing environments and in an environmental setup that is affected by more scarce resources, economic crises, and also the difficulties, political and otherwise, for governments to work together, and also for civil society organizations to get financing sometimes. Dengue fever, it should be noted, rages in over 100 countries. There are an estimate of over 100 million cases each year, and about 2.5 billion people are threatened by this disease, and there is no vaccine so far. But then scientists have said there is a possibility of a vaccine in 2013 or at the end of 2012.
People who have dengue feel often like they're going to die. It's not just, oh, I have a headache or I have fever or whatever. They really, really feel sick.
Dengue, this is one of main priorities in public health in Vietnam. You know, every year we have about 100,000 cases.
During the last 30 years or so, we can see an increasing incidence of dengue. If you analyze the data decade by decade, it has actually increased so much that it becomes a major public health issue in Malaysia.
Malaria is probably the most overdiagnosed disease in the world, and I think dengue is one of the most underdiagnosed diseases in the world. Dengue occurs in over 100 countries around the world. We estimate that over 100 million infections, probably many more every year. It's certainly the most important arboviral disease of humans.
I think that dengue has more impact than the other many diseases. As you know that everyone is at risk of dengue because of the vectors is everywhere, and the burden and the impact on economy, impact on the mental health of the parents, and many issues, I think, tremendous.
So about 2.5 billion of people are at risk. And then we have been waiting for vaccine for a long time.
The countries where dengue is endemic clearly send a message to WHO that this is a priority. And of course, because it's an epidemic-prone disease, when a country has experienced an epidemic, it rises further up. I think what is required now is a steady support and a steady prioritization that goes beyond an immediate reaction to an epidemic that a country has experienced.
We have biotechnology, we've got genetic engineering, all types of things are coming in. And the approach has been quite different in some of the vaccines that are now being tested. I think that really makes a significant difference in the progress that we are making.
We see progress with dengue vaccines, and I think it's very encouraging that companies are now planning really to engage into larger scale trials.
In our view, it seems that it's likely that the first vaccine may be licensed as early as 2013, perhaps with everything goes perfectly well at the end of 2012.
When we have a vaccine, we want it to be able to be used by the community, whether it is a developed country or developing country. I think the issue mainly is how to get it to the community in developing countries.
There will be countries that can probably buy the vaccine and can negotiate affordable prices, but there will be countries that will need assistance. This is absolutely sure.
We need to work with those people who are doing the distribution so that they can provide the vaccine in a safe and effective way and a cost-effective way.
And I think one also needs to keep in mind that we're not just talking vaccine costs, we are talking of other costs that come with the implementation of a vaccine, the delivery, the safety monitoring, and so forth and so forth. All these are things that cost money and need to be assured.
Degradation of the environment directly impacts on the amount of diseases that we have, and also impacts on the number of people who suffer from the incidences of over diseases, such as the incapacity of the head of households to work, and therefore high dropout rates for certain children, such as girl children, might also be a serious issue in terms of economic and social considerations. The more girl children are vulnerable, the more they are exposed to issues like early childhood marriages, as well as to the HIV/AIDS pandemic. Therefore, we think in this area that the best way to go about this issue will be an integrated approach towards solving the issue. Environmentalists, health practitioners, policymakers, civil society organizations must come together in comprehensive integrated policies to solve the issue. Without this, it will be very difficult to have one solution to solving the problem, because it is interlinked, interconnected, and related to people's economic, social, as well as other status. Thank you very much for watching Global Development Issues. It has been Arrey Ivo.